The Community Health Center of Buffalo is dedicated to keeping you and your family healthy. Now, part of that is obtaining and maintaining good health through preventative health care. For the next half hour, we're going to look at your health, physically, mentally, and spiritually. Now, these three factors are key to living a quality life. Joining us on the set today is Dr. Sadiq, our medical director, and Carla McDowell, our counselor. Welcome, ladies.
Thank you.
Well, basically, Dr. Sadiq, we're going to get right in with you here. How does your spiritual well-being, relate to health?
As you said earlier, that health is a component of three factors: physical, mental, and spiritual. In all beliefs and in all faith, we believe that there is a spirit, and mostly the spirit lies in the heart. And if you look at that, when people are under stress, when people are having a lot of mental problems, they get heart attack.
I see.
So our spirit, our heart has to be clear. Actually, it's a spirit is like an anchor. It's like an anchor to our body. We need an anchor in day-to-day life. If we are depressed or anxious, we need to hang on something.
And that allows us to focus our energy to something positive.
Yes, and I think the spirit, if we are cheating or lying, we are actually making our spirit sick.
And we don't think about that.
We don't think about.
We don't think, part of our health is our spiritual well-being. So when you talk to your patients and you might see that that's an area they need to focus on, what do you tell them?
I tell them the body is a wholesome. It's not only our arms and our bones and our skin and nails and everything.
External.
External. It's internal also. We have to see what's going on in our system. What are we thinking? How we are dealing with the stress? How we are taking day-to-day life? If there are a lot of difficult times, how we are handling that?
Absolutely.
And we're not taking everything as end of the life. We have to know how to deal with the stress, and that's actually spirit has a lot to do with it, how to handle the stress.
Okay, that's the A component of what we're talking about today. Now, say my spirit's well, Carla, right? I'm feeling great physically, Dr. Sadiq. What about the emotional aspect or the mental aspect of your life? I mean, how does that incorporate in, your health overall?
Well, just like Dr. Sadiq mentioned, nothing occurs in isolation, okay? So if your body's not well, then mentally you're not well. If your mental health is not well, it will have very telltale effects on your body. You could have decreased sleep, you could have increased anxiety, you could just, have difficulty concentrating. Those basic things, they say, well, I'm just worried about something, but I'll be okay. Well, after a while, if you put your body through that long enough, it actually starts to have a very real physical effect.
So a problem that I might face, say maybe trauma or depression, anxiety, something like that, it'll catch up with you eventually, is what you're saying?
It will always catch. Actually, it's not even a matter of catching up. It's never left. People say, well, I've dealt with that, or I'm fine. And what they're saying is, well, I don't have any symptoms. I don't cry as much as I used to, and I'm fine. I can move myself through it. But it just masked itself. That trauma, that victimization, that depression, that anxiety, that anger is just represented somewhere else. So they may not cry as much as they used to, but maybe they're more irritable with people. Maybe they don't have any bad dreams, but they're having difficulty concentrating when it gets to a certain topic. So it represents itself in your life. It just looks different than what it initially did.
So I know that you two work very closely together at the health center, making sure our patients are healthy physically, spiritually, and mentally. Now, if you have a patient that is exhibiting some type of symptom, or Dr. Sadiq, you find a patient that you feel needs to go see a counselor, what do you tell them? Like, do you refer them to Carla? Do you tell them, listen, you have to get right, mentally and emotionally as well? I mean, do you push that issue?
I think sometimes we just don't know how to deal with the situation. And it's okay to ask help. It's okay to admit that I need help.
Absolutely.
And then sometimes people have difficulty recognizing the problem and also asking for help. Our job is to diagnose and refer to the appropriate person. And the stress, as Carla just said, that lack of sleep, anxiety, depression, lack of sleep only can affect us physically. Our defense forces goes down if we are not sleeping well. So only lack of sleep can affect our body so much that we end up getting in a vicious cycle.
Your body really can't take it. It comes
Yeah.
to a halt. And then are you seeing your patients, you know, having symptoms of anxiety and depression as of, you know, because they haven't taken care of the problem?
Yes, often they say, oh, I'm just worried about something here, I'm worried about something there, but I tell them, well, when you're not sleeping is a key issue. Well, when you're not sleeping, you're more prone to having migraines, you know. When you don't sleep, you know, it affects your ability to, you know, concentrate or focus on things. When you don't sleep, it affects every major part of your body and of your day-to-day functioning, but people just don't recognize it.
Are you finding patients coming in and having like a sleep, you know, sleeping issues, concerns, sleep apnea, or any other problems? Are you finding that?
Believe it or not, when they come in, it's usually for something minor, okay, or a regular checkup. And as we get to asking all those basic questions that every good provider does, those things, oh, well, you know, I haven't really slept that well. Well, how long has that been going on? Oh, about 6 months or longer,
Wow.
different things like that. And they just, because it's been going on for so long, they don't really recognize it as a problem, but that's one of our red flags.
So they adjust their lifestyle to not sleeping on a regular basis, and they feel that's normal. This is my life.
Right.
So there's some key issues I want to talk about. We did talk about anxiety and depression, and that's fine. But how do your patients obtain good health when it comes to work, family, and environment? Those three key issues. Work. How does work play into being healthy?
I think keeping oneself busy is very good. We should never limit ourselves. We also, work is very important for one's life, keeping them healthy, but we also have to keep everything in a balanced perspective, and also
Yeah.
the balance in life. What's important, work appropriate hours, and then family life is very important. So we have to coordinate everything. We have to have a balanced life.
Balance is definitely key.
Key.
So we got work, family, and then their actual environment.
Yes.
Do you find patients that come in are overworked, or their families, you know, everyone goes through things, and we have family issues or whatnot, and we try to balance that, but are you seeing it more and more as, you know, the tough times are rising financially and people are losing their jobs and, you know, things aren't going so quite well? So what do you do?
I think that's very stressful these days. People are losing their job, and then they don't have health insurances, and they are going into the deeper and deeper hole. At this point, I would urge everyone not to be in a lot of stress. Things are bad, but things can get better.
Absolutely.
So please, and also ask for help. Come to the community center if you are having any problem, and you can ask counselor. Sometimes just talking to someone and telling them, listen, I'm very anxious today, I'm very
Absolutely.
depressed, can you help me out? Just talking to your friends, talking to people really is helpful.
Do you suggest, Carla, that they come in, you know, if they're having family issues or problems at work, to come in and talk to a counselor? Is that an important factor that you push when it comes to mental health?
It's always something that we push, and one of the things that I always tell people are, don't wait until it gets unmanageable. You know, some people, well, I'm going to try, I can do this, I can try to do that, and they wait until it blows off, you know, its hinges before they come and seek help, and by then, you know, is trying to do damage control. But come early, and just like Dr. Sadiq mentioned, talking is a release. It gets it out of your mind, and it gets it out in front of you so that you can deal with it.
Absolutely. Another